Today our topic is anti-goit drugs. As we can say that about anti-goit drug is that purines. In this we can talk about purines. Purines perform many important functions in cells. They have different functions as we can see that before being the information of monomeric precursor of nucleic acid, that is DNA and RNA. Purine which also contribute to modulate energy metabolism and signal transduction. Purines are structural components of some enzyme and have been shown to play important role in the physiology of platelets, muscles, and neurotransmissions. They have different functions like all cells require a balanced quantity of purine for growth, proliferation, and survival. So, as we can say that purine have a lot of function for our cell. Under physiological condition, the enzyme involved in the purine metabolism maintain in the cell in about maintenance of the cell, a balance ratio between their synthesis and degradation it is necessary for the maintenance. In humans, the final compound of purines catabolism is uric acid. The compound final compound in a human is uric acid. All other mammals have uric acid also. That uric acid is a possessed enzyme that uricase that converts uric acid to altein that is easily eliminated through urine. Overproduction of uric acid generated from the metabolism of purines has been proven to play emerging roles in human disease. An increase an increase of the serum uric acid is inversely associated with the disease severely and especially with cardiovascular disease state. The enzymatic pathway involved in the degradation of purines getting into structure and biochemistry until the uric acid formation. They're all about the purines topic. Now we can then now next is that in human the final compound of purine catabolism is uric acid. We talk about later that uric acid is the main component in human and also in mammals. Okay, we have DNA. Okay, DNA have two base pair. There is a red one and green one. Red one is thymine and green one is adenine. This is our base pair, and we are DNA is also composed of hydrogen bond and they also have base pair. And in this we can see that there is a structure formula of the thymine, or as you see. Other one is the purine catabolism. In the purine catabolism, there is a adenine that is and other that is converted into hexothymine by adenine diamines, and other one is xanthine dihydrogenase. In this, otherwise guanine that is converted into xanthine and by deamination. And as you see that the xanthine dehydrogenase is a enzyme that catalyzes the oxidation of thymine to uric acid. The other one is gout. Gout is a rheumatic disease that results from an excess body burden of uric acid or hypouricemia, which commonly manifests as a recurrent episode of acute joint pain. It causes different diseases and inflammations can lead to deposition of monosodium urate crystal. Any disturbance in their component, it cause disease in our body. Like it's you can see that there's topos is a monosodium urate concert to the joint. It causes disease. Hyperuricemia is caused by increased production or decreased excretion of uric acid or both. If there is increase or decrease, it causes disease. Increase or decrease of uric acid, then it causes disease. Like you see that the crystals. Other one is sign and symptoms of gout. What is the symptom and sign of gout? Then we can ask that he have a that disease. Any joint can be affected by gout, but it usually affect joint towards the end of limbs. If you have affected end of the limbs, then you have it causes symptom of gout, such as toes, ankle, knees, and fingers. Signs and symptoms of gout include severe pain in one or more joints. That joint feel hot or very tender, swelling in and around the affected joint, red shiny skin over the affected joint. Symptoms develop rapidly over a few hours and typically last 3 to 10 days. After this time, the pain should pass and joint should return to normal. Almost everyone with gout will experience further attack at same joint usually within year. It is severe condition. And now we talk about the furthermore the renal involvement of gout due to monosodium urate MSU deposition. What is MSU? MSU is a deposition in the urinary tract and result in urolithiasis and urinary obstruction. Hyperuricemia is caused by an increased production, decreased excretion of uric acid. In all these things, we talk about uric acid. If uric acid increase or decrease, it cause different diseases. It because it is a main component of our human body. And we can say the uric acid or both. Under excretion, the most common cause is thought to account 80% to 90% of hyperuricemia. 80 to 90% is hyperuricemia in most cases. Although the risk of developing gout increase with the chronicity and increased concentration of uric acid in blood is about 420, decrease less than 420 mole per meter. Not all patients with with hyperuricemia will develop gout. Uric acid normal in blood, you can see that u per mole male in male about 200 to 420 and female about 140 to 340. Diagnosis. The diagnosis is that for a definite diagnosis of gout, a urate crystal must be demonstrated in a synovial fluid or in the topus. Synovial fluid should be analyzed by polarized light microscope. We can cure it by light microscope that destroy this crystal into sand-like structure. Once definite diagnosis has been made, a repeat attack do not require diagnosis aspiration unless there is a suspicion of joint sepsis. A normal or low serum urate does not exclude the diagnosis of acute gout because concentration may not be elevated during an acute attack. There is a class of antigout drug, xanthine oxidase inhibitor, allopurinol, and fabuzotate. Uric acid secondary drug with primary uses that have non-eucrosic include lostrum and vostrium. Another thing, purate catabolism in purate catabolism adenine, that is what we talk about later, that adenine converted into xanthine and guanine converted into xanthine by xanthine dehydrogenase. It is a exo, which is an enzyme that catalyzes oxidation of xanthine into uric acid. And there are doses which we can use for this disease. The doses are that allopurinol or fabuzoxate. We can talk about tablets that the power of tablet is internal dose is about 100 mg or 300 mg and fabuzotate about 40 mg to 80 mg. Parental dose is a power powder for injection 500 milligram and half life 1 to 2 or 5 to 8 hours, as you can see in the screen. More common xanthine oxidase inhibitor side effect: more common ankle, knee, or great toe joint pain, joint stiffness or swelling, rash with flat lesion or small raised lesion to skin. There is rare side effect is that agitation, that's not good. Ammonia like breath odor, anxiety, bleeding gums, all are not good. Blistering, peeling or loosening of the skin, blood in urine or stool, blood nose, bloody or black or terry toes, that not good for himself. The primary urosurgic drugs are probenecid, benbromarenone, sulfonopyrazone. Okay, the mechanism of action of drugs are inhibition of renin transporter and therapy facilitating the excretion of disease caused uric acid by blocking reputate. As you see in the diagram, that glucose, amino acid, protein, vitamin, lactate, uric acid, all the rest in these in their vessel, and also urea, uric acid, that is, you know about that very well. Again, the name internal doses, parental doses, about parent we talk about later. Common side effect of uricocercis may include headache, dizziness, nausea, vomiting, lot of appetite, flushing, sudden warmth, redness or tingly feeling, sore gums, urination more than usual, itching, rash, hair loss. For patient experiencing of gout fear, colchicine and ASID glucocorticoids, that is IA or IM, first time overall inhibitor or ACTH, that choice of colchicine, NSAID or glucocorticoid based on patient factor and preference. Use topic ISAID adjuvant treatment. Mechanism of action of colchicine in the treatment of gout. The mechanism of the action of colchicine in the multithyroid pathology of acute inflammation associated with gout, and to consider the clinical utility of colchicine in other chronic inflammatory disease. Colchicine prevent microtubule assembly and thereby disturb inflammasous activation, microtubule based inflammatory cell chemotaxis, generation of teranase and cytokinesis and phagocytosis. In a common side effect of colchicine include